Hello, and welcome to Record Snooping, more common than you think. My name is Lance King, and I am the Vice President of Sales at Healthcare Compliance Solutions. I will be presenting today, and am happy to answer any questions about this presentation or about healthcare compliance after the presentation. So aside from being the Vice President of Sales, I am a husband and father of 3 girls. I am from Salt Lake City, Utah. And to get this out there, yes, I only have one wife. I don't know why I get asked this many times, but people think because I'm from Salt Lake City, for some reason I have many wives. So let's just get that out there. I am committed to one woman. All right. Now, who is Healthcare Compliance Solutions? Well, I'll be much shorter. We provide everything an auditor requires within the compliance plans manual that we provide medical practices. And that's all I'm going to say about that. So let's get into who this webinar is for. Webinar is for physicians, practice management, business associates, and anybody that has to deal with protected healthcare information. Record snooping is not new. It is an intrusive act that has been done by healthcare workers for a long time. However, with the new Hipaa privacy rules, what practices are finding is there are now very serious repercussions for the healthcare worker and for the office they work for. And the results of record snooping include the employer losing their job, public humiliation for the office involved, heavy monetary fines, and potential legal action. Again, this intrusive act is a big problem for the employee involved and for medical practices. And in 2015, record snooping is a significant reason why so many practices are receiving fines. What to expect in this presentation? Well, I'm going to go through 5 very brief case studies and discuss some different variables to consider with record snooping and how it impacts other individuals, as well as the levels of sanctions for record snooping, ways to prevent, and some quick conclusions. Now, before that, I think it's important that I show you the penalties for Hipaa violations. You'll see in this chart violation category and penalty per violation. Of the many fines that have come from someone snooping through records, did not know what to do, reasonable cause, willful neglect, then corrected, and willful neglect not corrected, fines are all in front of you. And along these lines, and before I get into the specific stories and case studies, I think it's important to note that as far as technology is concerned, technology is a great resource. One thing we're finding is that it's getting people into trouble, at least those individuals who are not really sure how it can impact record snooping and breaching Hipaa. Now, Hipaa does not suggest the use of or neglect of specific modes of communication. So texting is a valid resource. But I want to talk real quick before I move into this presentation about texting so that you'll inform your staff that they must understand the privacy and security boundaries of PHI when it comes to text messaging. Okay, so this is kind of a little bonus. So in the last 10 years, over 77,000 complaints of HIPAA violations have been recorded, and more than 18,000 corrective actions have been issued. And the corrective actions, what that is it translates in essence into hours of writing reports about what that practice and what those individuals will do differently as a result of the mistake or the issue. A lot of time that may seem very unnecessary, especially with how simple the issue may seem in the beginning. There really are many cases where PHI has been violated, and in many cases, practices receive fines up to $1.5 million. So that's how serious. And it's not enough to simply hope that an auditor will not visit a practice, especially with OCR having an increased budget and receiving help from various organizations to assist in second round audits in the fall of 2015. So, and they've indicated that they're going to be looking at small, medium, and large practices. And so keep in mind that having an awareness for these things is very critical. Now, here's really what the bonus is. I'm going to give 3 risks to consider with text messaging, and then 5 real brief recommendations, and then we'll proceed into the real reason that you're here, and that's to learn a little bit more about becoming informed about record snooping and how to avert record snooping issues. So the risks to consider with text messaging: first, text messages are not generally secure because they lack encryption. That's the number one most important part with that. Second, something a lot of people don't know, the sender doesn't usually know whether a text has been received unless a response is provided, and really that's just something we don't really think about a whole lot. And then third, the telecommunications carrier may be storing the information, and that could be very problematic in the future. So the recommendations, again, because there are many variables that are often unknown to the individual sending the text message, here are 5 recommendations your practice should consider when managing mobile devices for communication. The first is to determine whether mobile devices will be used to access, receive, transmit, or store patients' health information, or will be used as part of the organization's network or system, such as an electronic health record system. Next, you'll want to develop a mobile device risk management strategy, and that's something that can support privacy and security safeguards. Third, develop, document, and implement policies and procedures for mobile devices. And then the last 2 are just to consider the risks when using mobile devices to transmit information, and last, regularly meet to discuss mobile device privacy and security awareness. Those may seem very simple recommendations. Let me assure you that what may seem as common sense is not common practice these days, unfortunately. And a lot of that is because we're living in a very distracted society. People think they can juggle several things at once, and before you know it, you have a breach. Okay, so let's move on. So what is record snooping? Unauthorized access to patient information. Okay, we've already covered that. And it happens when an employee accesses a patient's information without cause, but rather for their own personal or somebody else's desire to have knowledge of that patient's personal health information. PHI is how I'm going to refer it. Guess what? We are all human. That is why you see Homer Simpson in the front. Yeah. Anyway, As such, we are naturally curious, and protecting the privacy of patient records, it just must be a top priority. And that means both internally and externally. So the problems with record snooping. Well, just 5 specifics. Number 1, it violates patient privacy. Second, it is a HIPAA violation. Third, causes public embarrassment to your practice. Fourth, go along with that, it lowers public perceived confidence in your practice. And fifth, can lead to large fines. Yuck. We don't need fines. We don't need a bad reputation. You need more patients. You need word of mouth. You need the reputation that you're helping people in the community, that they can trust you. So now to take you through 5 examples of record snooping so I can illustrate the many ways that small snooping-like activities can become big fines, fired employees, and lawsuits if you're not careful. So we'll start with UCLA Health System. They agreed to pay $865,500 as a part of a settlement with federal regulators. And they made this agreement because 2 celebrity patients alleged that hospital employees broke the law and reviewed their medical records without authorization. Yes, who isn't curious about the lives of these celebrities? What happened, though, is hospital employees were repeatedly caught and fired for peeping at records of dozens of celebrities. Again, only 2 celebrities alleged that the law was broken. Some of these you may remember: Britney Spears, Farrah Fawcett, Maria Shriver, to name a few. And this was something that, yes, it happened a few years ago. It's important, though, to note that federal investigators, they faulted the hospital system for failing to remedy the problems, discipline, or retrain the staff. So keep that in mind. All right, this past August, Caroline Clinic in Roanoke, Virginia, fired 14 employees. They were all found having access without a legitimate patient care need. And the discipline for inappropriately accessing the records is because of a high-profile case that was taking place in a local area. They just, again, they became curious, and here's the thing: what to do. Okay, if a big story pops up, it's important to regularly monitor employee access in the medical records system. I'm just going to say that while we're on the subject. Again, people get curious. Alina Hospitals and Clinics. This is a Minnesota health delivery system. This organization fired 32 employees. 32 employees. That's a lot of people. Now, fortunately, that's as big as it developed. What happened was they looked at records of patients involved in a mass drug overdose case. And in this case, 11 teenagers and young adults were hospitalized, and one actually died after overdosing on a synthetic drug at a party. And again, innocent curiosity. They were unaware that they were violating a federal statute. And they indicated that this was something that they work hard to prevent, but it happened. University of Iowa. A student healthcare worker, Catherine, was fired from the University of Iowa for violating the privacy of a pregnant female student and her well-known student-athlete boyfriend. The thing with Catherine, for over 14 years, Catherine had received HIPAA privacy training. That didn't stop her from revealing out loud to at least one of her coworkers that she hoped the young couple was happy with the positive results of the pregnancy test. Yes, that's very innocent. But Catherine went so far as to point out the student athlete to the clerk after she noticed him in the waiting room. Again, it seems so innocent. It goes another step. She also inappropriately accessed the patient's chart at least twice, opening the records from past visits and medication records as well. So, yeah, she was a little bit more involved. Now, the clerk went and spoke with 2 medical assistants, and these medical assistants were asked by this clerk about the reaction to the news. Was it positive? And then they reported the inquiry to a manager of a possible privacy violation, and that's what needs to happen. HHS.gov requires, by law, it's required that you report any breaches. And so that's a case in point example. Everett Clinic is our next and last. They're in Washington, and they use the Fair Warning software, which is a software that red flags unauthorized access to PHI. And not long after it was implemented, well, they had 13 people and 13 staff members and physicians were fired due to various incidents involving inappropriate access. Now, the CIO of Everett Clinic says our policy leans toward no tolerance of record snooping, and said that they investigate every situation to determine if the incident was malicious, accidental, or if a staff member just didn't understand the rules. So more than fair, but again, no tolerance policy. And perhaps this and other stories that we've talked about can just act as a reminder of how important ongoing training and regularly updating policies are. And also keeping in mind that while we're dealing with human beings, we need to set up some sort of an infrastructure to ensure that you mitigate this risk as much as possible. What we suggest is that you consider 3 levels of sanctions for record snooping: accidental, intentional, and harmful. And that's much like the CIO's plan of attack with this. So let's just go back for a second before we get into these 3 levels. It's important that you institute, again, because some people have zero tolerance policies, but again, because we're human beings and we're always growing, what we suggest is that you consider that some organizations institute a progressive system. So that's what we're going over this, where you have these different levels of sanctions, where the level of sanctions increases for the multiple violations or for particularly egregious violations. So scale that. I mean, you've got to make the decision for your own practice. So the first, I'm going to go through each with going through some possible scenarios, the sanction, and we'll talk a little bit about it. So possible scenarios for an accidental breach. 3 are, first is employee does not log off a computer after use. Very simple. Second, employee faxed the wrong PHI to another practice. Third, employee emails PHI to the wrong email address. Is anybody guilty of doing that? Have you ever done that before? It happens. So the sanction is warning and retraining. Verbal warnings should be documented in the employee's file, and then mandatory retraining certainly for the first offense. And then continued offenses lead to progressive discipline up to and including termination. So level 2, intentional breach without harmful or dishonest intentions. All right. Possible scenarios, I will go through 4. We have viewing patient records out of curiosity We've learned about what happens with that. The next, sharing PHI, which is any information that identifies the patient, including a few things. So diagnostic or treatment, financial information, or photos, for example. So sharing PHI in any personal communications or on social networks, because the information to them is interesting. So it can only be shared because of treatment purposes, of course, to those authorized. So then the next is employee shares a computer password. And lastly, discussing patient information in an unsecured area. Very important, that last one. So the sanction, written warning and re-education. But then we have the progression of this moves into a possible suspension. Now, if it's a level 3, willful or intentional breach with harmful or dishonest intentions, scenarios change a little bit with a little bit different intent. So possible scenarios using PHI for personal gain. For example, think back to the situation where you have Farrah Fawcett's information that's being shared by the individual at the UCLA health system. What if that information gets leaked out to People magazine or some magazine out there that ends up being in a grocery store? A lot of damage can be done, a lot of emotional damage to that individual. And again, this person's already going through enough cancer. Yeah, just it can be really harmful. And to get paid for that, that's just so sad. This is happening, though. This is a very real situation. The next, I'm going to give you 4 on this too. So number 2, using PHI to cause harm. So this could mean exposing information to unauthorized individuals or social networks because you dislike the owner of the PHI. And that could happen in a situation where perhaps somebody gets divorced. And then 2 more. So giving access to a restricted area to an unauthorized individual, and then just generally giving access to PHI to an unauthorized individual. So generally speaking. Okay. Now the sanction is, unfortunately, it's the employment termination, which is tough. Again, yes, we're all curious, but is record snooping worth the price of losing your job or possible legal action? Respecting privacy protects us all. So, best way to avoid any fines, firing, or frustration, just say no. Okay. I'm going to, excuse me, I've got some recommendations now. And this is the information that you should take into your practices. I'm going to go through 8 different things. And the first is to conduct a security risk analysis that is preferably guided by experienced compliance professionals, which will need training. This step will show the practice's due diligence in protecting confidential patient data. And it's also required by Hipaa. The next one is yearly communication of the no snooping policy to all of your employees. Every new hire should get both a written and verbal orientation to your practice's zero tolerance policy on snooping. And that should extend as well to all business associates, such as your accountants, lawyers, and IT professionals. And then, this is something that can be updated. And if you looked at a semi-annual meeting on this particular topic, I think that would be appropriate. And due to some of the changes in HIPAA rules, the practice can now be fined if a business associate does the snooping. So that's why, you know, let's just place some emphasis on making sure they're informed, because they do work very closely with you. Third, give employees only the minimum necessary access to protected health information. The receptionist does not need access to clinical data, and that'll eliminate the temptation to peek into Brad Pitt's files or those of an ex-spouse or a neighbor. Fourth is password protect medical files depending on a need to know basis. Employees should frequently be reminded that your practice prohibits the sharing of passwords and of user IDs. 4 more ways to prevent record snooping. Document a formal process for initiating and terminating access. Your office manager or practice manager or business manager should establish and document controls for granting and terminating employee access to patient records. And you should also consider the different ways of communication, and we've already talked about that. When an employee leaves the practice, it's important to know that access should be immediately shut down, excuse me. Last 3 recommendations: communicate and enforce disciplinary actions for snooping. People need to know what your expectations are. They should know upfront that suspension and termination is the result of any malicious intent, and people need to know. Last 2, conduct background checks. Follow IRSA rules, but conduct background and reference checks before new employees start the job. Make time for this. Many snooping violations, they go unreported, but running these checks are going to represent a reasonable due diligence. And again, it's going to prevent costly fines and tarnished reputation. Lastly, allow patients to restrict the sharing of PHI. You're required to honor a patient's special request for privacy, which, you know, example is an ex-spouse of one of your nurses that requests that he or she not have access to PHI. So again, allow patients to restrict the sharing of PHI. It really is okay. So just in conclusion, record snooping can cause serious harm to your practice. We've gone over 5 different examples. And there's no way to completely eliminate record snooping. There are steps you can take that will protect your practice if a violation occurs. If you need help specifically and need to understand the steps to take if you've already breached or violated, feel free to contact me. Here's my information again. And yeah, again, I've got an email address, but I'd love to talk to you on the phone. I'm also on LinkedIn. If you look at Lance King, you can find me there. And I publish regular information that can also support creating a culture of compliance. Well, thank you so much. It's been my privilege to serve you in presenting these principles on record snooping, and I look forward to connecting with you again soon.